My name is Meredith. I'm a family nurse practitioner that works in primary care, and I just came up on my 1-year anniversary of being a nurse practitioner and being in primary care. Actually, I became a nurse practitioner in February of 2025, but credentialing, all of the things takes a long time. I started practicing May 27th of 2025, and I honestly cannot believe what I have learned, how much I have grown, and continue to learn and continue to grow every single day. But I wanted to do a few takeaways. I have a very positive outlook on this, and I have zero regrets. It's actually the best thing I've ever done with my nursing career, and I encourage anyone that is interested in it to go do it. There's a lot of I think misconception about nurse practitioners on the internet, like some negative ones that, I don't know, maybe they just hate their job. And maybe I have the cream of the crop and it's the best job ever, which is probably true. I work with really great physicians. I have really great bosses and a supportive system. My nurse is my best friend. And yeah, we just all work really well together. So that's a really big positive that I have. Going from an RN to an NP, obviously there's more responsibility. You're making decisions. That's really scary when you first start because they teach you a whole lot of stuff in school and you get a whole lot of training. But when you are on your own, and yes, there is always someone to look to and ask questions to, but a lot of it you're doing obviously on your own. That gets better. There's always going to be a little imposter syndrome, and I think that's a good thing. I think that if you feel like you know everything, that's scary. You're never going to know everything, and you don't need to always know everything. You need to learn and research and learn through experience. With that being said, yes, you can ask someone for help. I do every single day. The way that changes in 1 year is literally incredible. I remember one of the first patients I ever saw, and I think it was for cough and congestion, something that's a very easy acute visit most generally. I was so worried about going to the room about what questions I should ask and how I should work them up and hope that I'm not missing anything and hope I'm treating them the right way. That just becomes so natural and so part of your normal routine that you've become very confident in treating acute things, and then also managing chronic conditions and having your own patients with a lot of comorbidities and things that are going on with them. If you have imposter syndrome, it does get better. You always should have a little bit of it, and you're going to learn and you're going to grow. And from seeing around 5 to 10 patients a day when I first started for the first couple of months, and I slowly added as that went, and now I see anywhere from usually 20 to 25 patients a day, and I feel very confident in doing that. I feel like I'm on a good pace, and I spend time with my patients and I listen to my patients, and that I'm giving really good quality care. So that's something else that you learn.